Hi, I'm Jeffrey Runge. I'm one of the board-certified attending surgeons you'll be working with at Guardian Veterinary Specialists. I wanted to give you a nice introduction on kind of what to expect when you're rotating through the surgery department. This department is made up of two board-certified surgeons, myself and Rob Hart. Both of us want to welcome you, and we want to make sure you have a good understanding of what to expect, what your expectations should be, and kind of what you may be getting out of it when you come work with us. Dr. Hart and I like to ensure that we're doing complex surgery with patients that often have kind of very difficult diseases to address. So you're going to see lots of different types of surgery here. You may find some procedures that are much more straightforward or ones that are super highly advanced. In preparation for that, I want to give you a good idea of what to expect. When you're at Guardian, you're going to notice that the attending surgeon like myself or Rob will have a team of people behind them and working with them. It's going to be nurses and assistants, interns, as well as externs like yourselves. What we want to do is work cohesively together. So you ask a lot of questions, make sure you know kind of where you need to be at different times, and don't be afraid to ask us as well. We're going to make sure you have an excellent time while you're here and make sure you're going to learn a lot. There's a lot that can be said about asking good questions, so come prepared. Do your best to make sure that you're prepped on the cases, and if you want to prepare the best, read about them the night before. The surgery department runs on about a 6-day-a-week service. I'm here from Monday through Thursday, and Dr. Hart is here basically every other Thursday and Friday and Saturday. Sundays are on emergency. Usually what happens is we get here around 7 o'clock in the morning and we get a sense of what our inpatients look like from the day before, and we also assess our new pickups, which are cases that are transferred to us from other departments. We look at all of our patients and go through their medical records and do our examinations. From that point, we start rounds for the hospital around 8 o'clock. Rounds are listened to on Zoom, and one of the doctors basically tells us what's going on while we're going over our paperwork. From there, we begin doing basic therapies that for some small bandage changes or potentially wound care, or even just more oversight on the patients that need to have a look at. In preparation for your time here with us, I'm going to ask you to provide us with a short CV and a bit of a letter of intent on kind of what you want to do for the next couple of years, so I have a sense of what your goals are and what your expectations are. I'm going to provide you guys with some reading material, that way you're prepped on what to expect when you're working in an environment like this. Some of it may entail disease-specific types of information, but also surgical prep, attire, understanding aseptic technique, and basic surgical principles that I think are going to stay with you forever. And I want to make sure that these are instilled in you while you're here. So if you don't mind, I'd like you to read that material before you get here. I'm also going to provide you some videos on how to basically have surgical etiquette, which means that what it's like working in the OR, what it's like with your role in the OR, and how to get yourself in the best possible chance to learn in the OR. So that'll go over basically what it's like when you're scrubbed in, what it's like scrubbing in, how to properly scrub in, and understanding the instruments that we're using, and basically what your role will be in the operating room itself.